She studied a Bachelor of Science in Nursing. That makes her very knowledgeable on all things NF. You may know Kate's name from her YouTube series, Ask Kate, where she answers questions that come in globally from the NF community. We're so thankful for your time today, Kate. Thank you so much.
I'm very happy to be here. Thank you, Jasmine.
Tonight, we'll also have Meredith and Ruth join us, support coordinators from the Children's Tumor Foundation Australia. We're recording this session so that it can be a resource for now and for the future. I think it's something really important. So welcome, Kate, and thank you. The first question that I have comes in from Fiona. Many parents are understandably reluctant to put children on long-term strong pain medication. What alternative treatments do you recommend for children with pain?
Yeah, that's a great question. Thank you. Pain is a very big topic with really across all of the neurofibromatosis diagnosis, right? And with children in particular, yes, there's a real sensitivity to being cautious about what type of medications are used. I think one thing to keep in mind as a caregiver or parent is the idea of the quality of life, right? And so some of these medications might address pain, but they might also affect the child in ways that really diminish quality of life in other important ways. And so we have here in the US a growing interest in looking at pain in the general population even, but especially among people with any type of chronic condition where pain is a significant factor. So some of our medical centers now, a lot of them at this point, do have dedicated pain teams. And so these are physicians and social workers, psychologists, physical therapists, massage therapists, and then other types of alternative therapy providers, things like acupressure, acupuncture, again, I said massage, looking at how can we disrupt those pain centers and the kind of especially since in NF, a lot of times there's not a direct correlation to the pain is because of X, right? If you break your arm hurts because you broke your arm, right? That's not always the case with NF. Sometimes it's a more generalized pain, or sometimes it's, they can't find it's this tumor or it's this whatever, right? So looking at it from that holistic point of view to say, what are some of the other things that we can do to address this pain that are not medications? It's hard to say anything specific without knowing specifics about a particular situation. But I do want to encourage families to think kind of outside the box about that with their providers. And also, I think another important piece with pain is the idea that there's a lot to be said for the mental health component and engaging the brain when it comes to dealing with and living with any kind of pain. There's a lot that happens just in our own mind when we wake up in the morning and we're in pain. Is it, this is the worst pain, it will never get better, I will never feel good, right? That's going to set up a very different day than, okay, today my pain is, a 3 out of 10, and yesterday it was a 7. Okay, that's good. How can I, capitalize on that? Today, maybe I'll be able to accomplish this, or today maybe I need more rest, right? And so there's a big component there as well. That is something that there's a study that's based here in the US, but is open to international patients, that if anybody is interested, I'm happy to share more information, via email, but looking specifically at that aspect of how can we address living with pain from that attitude of resilience, essentially.
Such a good way to look at it. Charity has Naomi has asked, can you please explain why people with NF1 can get sporadic stabbing pain in the absence of identified tumors? Yeah. Is there anything we can do?
Mm-hmm. Yeah, it's a really good question. There's not a good explanation for that. In fact, I think it was in 2019, maybe 2020, we published a new article that had sort of general guidelines for both one article about adults with NF1 and one for children that had guidelines for sort of how to take care of yourself, what your doctor should be checking for as you get older. And one of the things that article concluded is that pain in NF1 is really understudied. It's not understood well, and not a lot more research is needed. So that type of, it's probably nerve pain. There are some things that we try. There are some medications they might try that may help with nerve pain, but there's really not a well understood explanation for why that happens. And as far as what to do, I think it's a little bit of what I've already talked about, and just continuing to advocate for yourself and to be working with your doctors, and really that focus on what's my best quality of life here, like what are my options, and things like massage and different types of alternative therapies to see if any of that is helpful.
That's really important. Julia has asked, we know about bone abnormalities in NF, but is there a predisposition for osteoporosis for patients with NF? And is there any concern for poor absorption of vitamin D? Mm-hmm. Is this a contributing factor?
It's a fantastic question. We do know the studies do seem to show an increased risk of osteoporosis as individuals living with NF1 get older. It's not well understood yet. There's not a clear correlation between the osteoporosis and vitamin D absorption throughout life. But the general guideline is that vitamin D supplementation for anyone with NF1 is an important thing, and that there really are no downsides to vitamin D supplementation. There's really not a lot of risk that goes along with, taking the vitamin D. So yes, we do recommend regular vitamin D, every day, taking that, and hopefully that it's protective, but screening for osteoporosis is also very important for adults living with NF1, because we do know that there's a higher risk as to why exactly that happens, not as well understood.
Sorry, Kate, can I just interject there? So in terms of vitamin D supplements, would you also recommend a calcium supplement for people with NF1?
Yeah, that's a great question. There's really not a downside to taking calcium. And when we know that there's an increased risk for osteoporosis, yes, I think that taking a calcium supplement is an excellent idea. I always add the caveat that, any supplement you're going to start taking, talk to your doctor about it. Make sure they know. They can, advise as to, what dose they think is appropriate for you, et cetera. And it's just important that your doctor know anything you're taking, even if it seems benign, like a vitamin.
Thanks.
Jane has asked, many children with NF1 have low muscle tone. Is there a correlation with Ehlers-Danlos syndrome and other connective tissue disorders with NF?
Yeah, no, that's a good question. So we know that children with NF1 have what we call hypotonia, so low muscle tone. And this is something that actually, if you do an MRI of the big thigh muscle, you can see the way that the muscle fibers are looser. It's quite interesting to visualize it. And so that basically means that these children, they can be later to crawl, later to walk, one of the last kids to kind of figure out how to ride their bike, because they a lot of times will have low core strength as well. So, they sit later. So there's all these types of things. We don't see that in the long run, that there's any kind of, most of these children can through physical therapy, kind of get caught up to the point where by the time they're in grade school, this isn't something you would necessarily notice. Certainly with some kids, they need support in other ways. And I even have adults that I've spoken to that I was speaking with one gentleman who works in a custodial job, and so he does a lot of cleaning, and he was asking for some help to request with his employers. Some of the fine motor things they were asking him to do were quite challenging. And so just working with what we call the disability laws here in the US to make sure that his job was protected, despite the fact that there was a couple of things that were difficult for him. So that is an issue. But for most of the part, early intervention with physical and occupational therapy in kind of starting in those early days, can really help those kids in terms of, and so that's why you see the hypermobility, right? You get these looser muscles. And so a lot of times they are very flexible. As far as connections to conditions like Ehlers-Danlos, there's not a clear connection in terms of, or any kind of correlation or, but I mean, there are case studies. I read a case study after I saw that question about somebody who's diagnosed both with NF1 and specifically Ehlers-Danlos. So, but there's not a good understanding. And it isn't as if your child were diagnosed with NF1, we would immediately recommend that they also be tested for other specific genetic conditions at this point.
No. Thank you. We have Gwen, and she has a question. Any dental issues, such as tooth decay, like extra prevalent in people with NF1? Should this be something parents should be mindful for?
Mm-hmm. Yes, actually. So we do know that children with NF1 and adults are more prone to increase in cavities or dental caries. We don't necessarily fully understand why, but we do recommend, I mean, really the recommendation is still general population seeing a dentist regularly. Here it's every 6 months for cleaning and evaluation. Good, oral care with your child is going to be important, brushing and flossing, because there does seem to be an increased risk for that. But in terms of how you address it, it would be the same recommendations as for any child, but just with sort of that eye to making sure you don't miss those visits with the dentist to address that stuff.
Hillary has asked, is there any evidence that people with NF are more likely to have other rare conditions?
That's a very good question. Not really, I guess the short answer is no, but I can hear my genetic counselor friend who also works for CTF in the US, Heather, telling me to be cautious with that no. She would say that, what does it mean to say that, is there increased risk, right? Genetics are extremely complicated. As you know, we're even right now looking at the naming of NF2 and Schwannomatosis, and even just listening in on that conversation yesterday as they're talking about the genetic component of that. So again, there's no recommendation currently. There's no guideline that if you have a diagnosis of NF1, that there are any other conditions that you should then, immediately be screened for. But we do see, I'm going to leave it at that.
And then my next question is from Amy. Amy has asked, many children complain of stomach issues. Parents are frequently told that it's constipation or food intolerances. Is there any experience of tummy issues being common with NF1?
Yes, this is not uncommon at all. This is one of those areas that is not well understood. In general, children with any type of stomach complaint, even in the general population, the figuring out the cause and then addressing it is incredibly challenging. And this is true for all children. And we don't at this point have any reason or there's not a lot of, it's because of the NF1, right? This stomach issue is because you have NF1, right? That's, is it anxiety? Is there an emotional component? Children do tend to carry their emotions in their intestines, like in their bellies. They just do. They get constipated and they have diarrhea and they have these things when they're upset. Is your child taking medications that have side effects, right? That could be contributing. Are there, and dealing with things like constipation in children is so hard. Because, what are they eating? And if your doctor recommends a special diet, is that something your child's going to be able to tolerate? Like, It's just really challenging. So mostly I just want to offer my empathy for how difficult that is as a parent to try to manage and try to get your child some relief so they're more comfortable. And I think this is another area where it's just important to use those advocacy skills as their caregiver to say, you know, we tried this thing that you recommended. This was our result. We're not really happy with that. You know, again, we're going for quality of life. And so figuring out how to balance what the doctor might say you can try, such as, you know, try to figure out if there is a food intolerance issue. So maybe we're adjusting the diet. Can your kid tolerate this other diet? Is it actually helping? I do recommend keeping a food and symptom log. So really, a lot of times I know as a parent, if my child, for example, one of my children gets a lot of headaches. Nobody in our family has NF, but she gets a lot of headaches. And so I was feeling like she's a headache every day. So I started keeping track, and that wasn't actually true. It wasn't every day. We started to see some patterns, right? It really helped. So I really recommend symptom and food logs so you can start to see some of those patterns if they're there. And that can also really help your provider in coming up with some solutions that might help.
That's a really good idea. Carla has asked, my child is scheduled for a spinal fusion due to scoliosis. His neurosurgeon has said that he's at risk of bleeding due to weakness in tissues surrounding the neurofibroma. Could you explain this to me, please?
Yeah, that's a great question. So first of all, I'll say that the neurosurgeon needs to explain that himself as well. So I have a really strong, you'll see this with me a lot, is that, and this comes from my years working as a nurse in clinics with physicians, that anything they say, they are responsible to explain fully until you completely understand to the best of your ability. So if you have to ask 25 questions, they need to answer them. That is their job. It is their responsibility. So I love the question. I'm happy to answer it, but I always want to start with saying that you should never leave an appointment. I mean, it'll happen where you leave and you think of questions later, and that's fine. And you come back and you can ask them. But you should never leave feeling like you weren't allowed to ask your questions, or that your questions, they were being refused to be answered, right? So the increased risk for bleeding is really just that when you're dealing with neurofibroma tumors, like they're tumors, right? We know they're benign, but they're not kind of normal tissues. And so they can be highly vascular, meaning they can have a big blood system that's feeding them. And so when you go in there and you start removing things, or you start working near and around them, if you irritate or aggravate them, there can be an increased risk for more bleeding, just because of the way that the vascular system is sort of feeding them.
That makes sense. Sally has asked, is it safe to get laser treatment on plexiform neurofibromas that have hair growing out of them?
Yeah, so that's probably not a question I can really answer, essentially because I'm not sure what laser treatment exactly means. I don't know if we're thinking cosmetic, like you want laser treatment to remove the hair, and that would be something to talk about with your NF provider. If you mean as a treatment for plexiforms, right? So it's a little bit complicated to answer a question like that. And especially when it comes to safety questions, we're cautious because there's a lot of factors, right? Where is the plexiform neurofibroma? What type of treatment are we talking about? Is it with a provider who understands NF or not? So that's the kind of question I would encourage someone to reach out to me directly so that I can ask those kinds of questions and see if there's more of an answer I can give.
Awesome. Thank you. Simon has asked, I have a partial sunken chest. Is this likely to get worse as I get older, or are there some exercises I can do to help?
Sure. So we know that the clinical term for what Simon is describing is a pectus excavatum. It's one of the kind of bone deformities that can happen in NF1. Generally what will happen is that it's there from birth, but it will sort of develop and become most obvious during the big growth spurts of puberty. And after that, you shouldn't see a significant change. It shouldn't get any worse because it's bone, right? So it's formed and it's done growing. So there shouldn't be any significant change after this point. As far as exercises go, the more, like if you were going to do a lot of weightlifting, for example, it might look more pronounced, only because you would be building those chest muscles, but it wouldn't be a bad thing. It would still be good in terms of general health. But there's not really any kind of exercise that would make it look less kind of depressed, right? So hopefully that's helpful.
Thank you. Julia has asked, I've had several glomeus tumors removed from my fingers. The pain from the tumors is gone, but what remains is something I'm going to call nerve pain. Is it because the nerves were damaged after surgery? Or if so, how long will this nerve damage last for?
Okay, good question. Yeah, glomus tumors are actually more common in NF1 than I think we previously understood. One of the biggest problems with them is how long it can take for them to be diagnosed properly. And even though it's just like the fingertips, they're really painful. And so adults will go a long time with a lot of this pain, excuse me, and kind of never get or be waiting for that diagnosis. So the awareness of the glomus tumors is really important, so that if you're experiencing this type of pain, you can know what to ask that they look for, right? Often the removal is curative for the pain. So a lot of times once we get them out of there, the pain goes away. In this case, that's obviously not what's happened. I can't say for sure, but it does sound like potentially there was some nerve damage or nerve disruption that went on. I would expect that would get better over time. But I would also say to talk with the surgeon or with your NF provider to say, I'm still having a lot of pain, just to make sure that everything has been removed like that was in there, because it's weird, they can be really tiny and hard to identify. And so, making sure of that. And then again, talking about, what are some ways that we can address the pain that I'm still having. Some people will take a medication called gabapentin, which is for nerve pain, and it will help. For other people, it doesn't help at all, right? So, but still definitely addressing the pain that you're in with your doctor and seeing if there is anything that you can try in the meantime.
That's always good to do. Paula has asked, is there anything I can do to prevent neurofibromas from forming?
Yeah, I get that question a lot. Unfortunately, at this point, there's not. There are no recommendations for, diet changes or staying out of the sun, or, there's nothing really like that that would affect the growth or the appearance of new neurofibromas. We do know that you see the biggest increase in those during puberty and for women in pregnancy. So those big hormonal shift times in life is when you're going to see the appearance of new neurofibromas. Now, in some populations in the NF community, we have people who get so many of them and they continue to get new ones throughout their life, and we still don't fully understand why. One of the things that we study here is trying to figure out if there's a connection between the specific mutation someone has on that NF gene and the way that NF impacts them. Because we know there's a huge variability with people living with NF1 in particular, where, two people can have it even in the same family often, and it will impact them in vastly different ways. And the neurofibromas is one of them. So yes, that's unfortunately at this point, no recommendations in terms of how to prevent them from showing up.
One of the studies that was just funded here recently is looking at exactly that as well.
Yeah, it's really important information, and I'm hopeful for how it can impact the field as we continue to learn more.
Tracy has asked, what do you recommend adults should do to monitor their health each year?
I love this question because we just had this wonderful article that was published that goes over exactly that. So I'm not going to go into all of the different things. I think seeing someone regularly who understands NF is really important. Even if you feel that you're, your health is not as impacted by your NF as maybe other individuals, which is often the case. But just that regular appointment, talking about, how you're feeling. And so we do things like check vitamin D levels. If you have any type of tumor burden, maybe we're looking at that tumor burden with an MRI. So there are a lot of different things. Women with NF1, we know now, may be at increased risk for breast cancer. And so there are some recommendations as to breast cancer screenings. But I think what I'll do here is I'll just make sure to share this article with Meredith and Ruth, and they can include it, and have that available so that people can, because I often will recommend just print this out and take it to your doctor and talk about it with them.
And we have breast care information as well. So please, anybody follow up with us, because we have a lot stuff we can share with you. Just on
Yeah. No, that's wonderful. Thank you.
Yeah, just for your interest, Kate, that recently in the last couple of years, women with a diagnosis of NF1 between the ages of 30 and 50 get MRIs free here.
Oh, that's wonderful. Yeah, and it's similar to the recommendations here. I don't think things are free where I live, but that's wonderful.
Help people with all of that information if they get in contact with us.
Good, wonderful.
Helen has asked, what do you suggest for children who get itchy?
Oh my gosh, yes, itching. That is so frustrating. There's really not good treatment for this. It's really disruptive for these kids, right? I mean, if you've got a kid with something like atopic dermatitis or eczema, as it's sometimes called, right? We know there's some things we can do. The skin is dry. How do we hydrate the skin? How do we, but with this, it seems to be something nerve related that we don't really understand very well. We know it's a problem. Sometimes antihistamines, like a daily antihistamine, which is fairly, pretty safe. Obviously, talk to your doctor. I mean, you wouldn't just start doing that without speaking to a pediatrician, but sometimes that can disrupt that itching and help. And for some kids, it doesn't help. So unfortunately, there's not a lot to say that we know makes this better. But again, actually, I would recommend sort of logging the symptoms, because maybe you'll find that there are certain things that aggravate the itching, certain activities, or but I'm sorry, it's in the pediatric guidelines article. It's in there saying this is a problem. We don't understand it. We need to look at it in a more in-depth way.
Thank you. April has asked, can you talk about the new cream being trialed for cutaneous neurofibromas?
Yes, this is very exciting. There's a company here called Inflection that is doing research on what they're calling NF179. This got orphan drug status approval here in the US from our Food and Drug Administration, which basically means that it gives them a little bit of a faster track to approval in general for being able to be prescribed by doctors. It is part of the kind of MEK inhibitor family in terms of those drugs that maybe you've heard that we got approval for Koselugo, which is a different, it's an oral medication for the treatment of plexiform neurofibromas, but it's in that same MEK inhibitor family. But this NF179 is a cream that's applied. And the FDA was impressed enough with the results of their phase 1 trial that they gave them the orphan status, and they are currently recruiting for phase 2, which essentially just looks at best dosing, kind of best guidelines for how to use the cream, which means that they've already been able to show, and I haven't been able to see the results, but they've been able to show to satisfaction that it has an impact and that it helps. And now they're looking at saying, okay, if we're going to actually tell people to prescribe this, how exactly should they do that? So they put people in different groups and they say, okay, they're going to do it this way and you're going to do it this way. And then we're going to kind of see what seems to work the best. But it's very exciting because as a cream, obviously it's much better tolerated. And it could, the neurofibromas, despite, being, they're benign and whatever, they are very, very frustrating to many adults living with NF1 in terms of just the cosmetic issues. And they can be painful. So we're excited about the possibilities, and hopefully that will be coming. I don't know a timeline for how long all that will take, but it's very exciting.
Very exciting. Scarlett has asked, can you please talk about the incidence of autism and learning difficulties in children with NF, and what would your recommendations be as a parent?
So we've known for years and said for years that there's an increased risk for learning disabilities in children with NF1. We always recommend parents consider neuropsych evaluation, which is just sort of a in-depth look at how your child learns and processes information. If this is done in the early years as they're getting started in school, that's fantastic. And so we recommend that kind of evaluation, right? Working with their school, if you are seeing issues cropping up, and getting support at school is important. So when it comes to learning disabilities, we kind of know that's there. The way they're dealt with is the same as any child, getting support at school, accommodations when they're needed, if they need extra time for tests, if they need to be able to leave the room for certain things, that kind of thing. So again, this is an area where parents and caregivers have to do a lot of advocating for their child to make sure that, because also neuropsych testing, what I tell parents is it's not just going to tell you what your child is struggling with. It can also tell you the things that they're fantastic at, like, and how to build on strengths. So it's really a great tool to have for any child. The other piece of it, the autism, that is newer. We used to say, no, we don't know that there's any relationship. We are now aware of the fact that when you think of autism as a spectrum, instead of just a black and white, you have it, you don't have it, but instead you think of this is a spectrum where, you've got children in the general population who are on the spectrum to the point where maybe they're nonverbal and they need a lot of support. And you also have kids who, do great and they're in school and they have this, we call it the autism spectrum disorder now. That's like the ASD. That's what we call that, because we know that, this is not just a box you check, right? There's also a lot of movement in the US here from the autistic community that, there's nothing wrong with us. This isn't something to fix, right? This is just who we are, and we operate in the world in this way. And there's some really cool things we bring to the world because of how we think and how we interact with, the world and the information around us, right? So for parents, it can be very scary when we say, no, we are seeing that children with NF1 do have increased risk for this ASD diagnosis. That can be very terrifying because they think of kind of worst case scenarios and whatnot. But we also know that with early intervention, these kids can do really well. They're not, going to be necessarily disabled, in some way that they can't be independent adults, right? So just keeping your eyes open to potential indications that your child might need to be evaluated for autism, and things like they're kind of those social cues, right? Are they making eye contact? Are they affectionate? Do they shy away from touch? Are they sensitive to things like sound? And and I know as a parent that sometimes you are paranoid, but that's why you work with your pediatrician, right? You say, I'm seeing this, should I be concerned? And then you can kind of go from there. And here we have something we call them developmental pediatricians. And so children who might be showing signs of something like autism will see a special developmental pediatrician who can do a more in-depth exam and evaluation of them to see if there's something that needs to be addressed.
My last NF1 question is from Katie. And she's asked, how do I explain my NF to employers, employees, family, and friends about my NF without causing them any alarm?
Yes, that is very challenging. I think the most important thing, so when it comes to employers and work relationships, you're not required to disclose anything that you don't want to. However, I think if you are comfortable and you feel it's safe, that openness can be a wonderful thing, especially if your NF impacts you in a way that might impact work, right? So for some people, maybe you get migraines and you might need some time off, or maybe, there's any number of ways, right? And so that openness, if you feel that it's safe and in your best interest, can be a really positive thing. We actually have a really great program that's been growing over the last few years, looking at kind of bullying in school and how do you address that? And what we know is true from research outside of the NF world is that information is power, right? And so helping the people around you understand and really be knowledgeable about NF takes away their fear. And a lot of times when people are unkind, it is because of fear and misunderstanding and ignorance. And so the more that they can understand. And so, there's lots of great resources. I know CTF Australia has great resources on this. We have them here on our website for free as well, that are brochures and whatnot that talk about how to explain having NF. And I think the most important thing is is explaining how it impacts you, right? And what's your story. People really connect to stories. And so instead of trying to educate them as if you're a doctor explaining a disease, you say, this is who I am and this is part of my story. It's not all of who I am, right? So I think that's a really good approach.
I think, thanks, Hannah. I think there's a lot of power in that, and we have lots of resources that support that. So if you're anybody out there who's thinking, what should I do? Who can I talk to? Just give us a call, and we're not going to make you tell anyone. We're not going to, but we have the resources that might give you the confidence to share your story. That's all that you can do. Or even maybe just talking it through with us is, oh, I could do that. Or if you wanted to write a letter, or there's so many things we could do to help support people do that if they feel it's something they want to do and it is impacting their life and they feel it could make their life better. So
yeah, that's wonderful.
And I love your advocating with doctors and for yourself and being your advocate for your child. And again, we have millions of resources to help parents do that. We've got a teacher's toolkit that we send out to parents to share with schools, or we can send those directly to the teacher. And the impact has been amazing. I think it explains NF. So you have that child and that teacher who's got 30 kids and they're thinking, okay, yeah, that's something. I can work with that. It doesn't change their opinion of your child. It doesn't make your child any less or any more or anything. It just gives the teacher literally a little toolkit to help support your child. Mm-hmm. So thank you for everything you've said. It's wonderful.
No, that's great. Those resources are invaluable. So it's wonderful.
And we're writing more and more every week. So before you go, our community are just desperate for information on research, and just if you could give us a general overview of what you think are the most sort of noteworthy and promising research studies that are underway at the moment. So you've talked about the cream, which I think people will be really excited about. We've got the MEK inhibitor trials starting here. So you're a bit further advanced in it being approved over there. But just anything else that you think is new and noteworthy that people would like to know.
Sure. So one thing is that with the approval of Koselugo, which is the selumetinib would be the general name, the generic name for that. We're now running a bunch of studies looking at, do they have to stay on it forever? What happens if they come off of it? Can we can we have off for a while and then back on? So there's a bunch of research looking at that. We're also looking at that drug for a lot of other uses. We're looking at it for NF2 tumors. We're looking at it for the cutaneous neurofibromas. Obviously, the gel is a topical option, which is fantastic, but they are actually looking at the classic pill version of selumetinib for cutaneous neurofibromas. So they're basically saying, we see that this works. Let's see if it works on all of these other things, right? So that's one thing I think is exciting, and we'll have more information in the coming years. The Schwannomatosis study that is starting up at Johns Hopkins here is really exciting. It's looking at a drug called tanezumab, and it's looking at particularly its impact on pain and whether it can be used as a treatment for pain in schwannomatosis. Because one thing we know is that often the pain in schwannomatosis does not respond to classic interventions, right, in terms of classic drug options. So that one is very exciting, and I'm looking forward. It's just getting started, so it'll be a while, but I'm looking forward to seeing what comes of that. And then I did mention briefly this Intuit platform trial. So in the NF2 community, I'm most excited about that. Just the possibility for the speed at which we could see a lot of different papers being published and results coming out, which of course then just kind of speeds up that whole process from research to, something patients can access. So I'd say those are the things that I'm most excited about that are kind of coming or in the works.
So much hope for the future.
Yes, I agree, Jasmine.
We'd all like to thank you so much tonight for your time. I know it's so early in the morning over there, but your time is invaluable, and we're so incredibly grateful to have you.
Well, I really enjoyed this. I like answering questions when I can. Hopefully my children waking up for the day is not something anyone can hear. So
can't help that. Thank you so much, Kate.
Thank you so much, ladies.
Thank
This
you,
was wonderful.
Kate.
I really
Yeah,
Please
appreciate
have
it.
a lovely
Very much.
day.
Thank
Bye,
you.
guys.